Good morning, everyone. It is Thursday, February 10th. Welcome into the Morning Medical Update. Thank you so much for being here with us on Facebook and on YouTube. Novavax, which does not use the mRNA technology, is quickly gaining approval overseas. Dr. Kevin Ault is with us. He's an OBGYN here at the health system and also a member of the CDC's ACIP advisory panel. He's going to join us and see if this will soon be available here in the U.S. We'll talk all about that. Plus, why are vaccinations for kids 5 to 11 lagging so much? Dr. Stephen Lauer is with us. He is a pediatrician also here at the health system, and he's going to share what he's hearing from parents and what is the status of vaccine for those 4 and under. So please make sure you get your questions sent in to us there on YouTube, Facebook, and you can email us at the Medical News Network. They're right there on your screen. But before we get to all that, let's get to the COVID count and Dr. Dana Hawkinson. Good morning to you.
Hi.
Hi.
Yeah, cases continue to go down. That's good. 69 active infections right now with 18 in the ICU. So even our critically ill patients, ICU patients, have decreased a little bit. 6 still remain on the ventilator, so a third. And then 96 in that recovery period for a total of 165. But again, I think it's good news. Our trend continues to be lower hospitalization.
All right, Dr. Hawkinson, thanks so much. We'll get back with you here in just a minute. The latest numbers, though, find more than half of those living in the Kansas City metro area are vaccinated against COVID-19. Now, recently, the Mid-America Regional Council reported that nearly 60% of people in the metro have completed their COVID-19 vaccinations, while roughly 74% have begun the vaccination process. Doctors Kevin Ault and Stephen Lauer are here to talk more about vaccines and the pandemic and kids and all sorts of stuff this morning. So Dr. Ault, let's get started with you. We know that adults are still hesitant when it comes to the vaccine. The ACIP committee last week voted unanimously to fully recommend the use of Moderna. How do you think that will help with the vaccination rates? Let's talk about that.
Well, we had a meeting last Friday, one of our many emergency meetings we've had over the past 2 years. Basically, that vaccine now has full approval. It moved from the emergency use or EUA recommendation to a BLA recommendation. Probably nobody knew what a BLA was before the pandemic, but it's a biological license application, and it's fully approved. This vaccine and shingles vaccine and all the other vaccines that adults and children get. And the advantage we had was that, we had tens of millions It's similar to the other vaccines. They've had some other vaccines in development, but basically it's a surface protein. And there are lots of examples of those kind of vaccines that we give. The human papillomavirus vaccine is that way. I'm sure you could probably think of a lot more, but that's the one that pops into my mind because there are some similarities there.
So do you think that approval will help get more people vaccinated?
So yes, but not just in the United States, but globally. The protein vaccines have a little friendlier handling requirements, and so they don't necessarily need refrigeration and that type of thing. So you can get to some of the hardest to reach populations. 40% of the people on planet Earth have had 0 doses of vaccines. So this isn't going to end until we can get some of those people vaccinated.
Your thoughts, Dr. Lauer. Good morning, by the way.
Good morning. Yeah, I think just the more options there are for people as these new vaccines come on and the more data comes in, hopefully it starts to convince those people who are on the fence, with some worries from what they're hearing about, is this safe? Is this what they should be doing? Hopefully it moves that moves them into the group that says, yeah, let's go ahead and get vaccinated.
Let's go back to your position with the ACIP committee. Explain to people how that works so that they understand how these approvals come to be.
So there are 15 of us on that committee. We advise the CDC director. It's a mixture of people. There's a transplant immunologist. There's me, who's an OBGYN. There's several pediatricians. There's a nurse. There's a lawyer as the consumer representative. And we vote based on the data that is presented to us on the emergency use authorization BLA applications, somewhat similar to what the FDA does, but then we put a lot of nuance on it. And if you heard, it was late on Friday afternoon, so you may not have heard, but we were talking about spacing between doses and some other nuanced messages that the FDA doesn't really deal with. We usually do when it's approved and then go into post-marketing surveillance of safety and changes in dosing recommendations.
All right, let's talk about kids. How soon before vaccine approval for those kids 4 and under?
Well, the FDA has announced, again, keeping with the pattern I mentioned before, the company announced, then the FDA announced they're having a meeting next week, so we'll need to have another emergency meeting in the next few days after that to put all the nuance on that recommendation too.
All right, that would make your life a lot easier, perhaps. Talk about what's going on inside those clinic rooms. When you're meeting with parents, what are the concerns? Where are we at?
Yeah. Well, there's still a lot of concerns, I think usually phrased as one of two things. One, kids don't get that sick, and so maybe I should just wait. And secondly, just still concerns when faced with a lot of misinformation out there about, are these safe, this is new, things like that. So a lot of things phrased that way. We try and talk with parents about, especially with Omicron, that this is getting a lot of kids sick. There's been millions of infections in children, many just in the last month, increased hospitalizations and even deaths in children. So trying to get that information in front of families and help them to understand that getting their kids vaccinated is still the safest way to prevent them from getting sick.
So do you factor in the time it takes to have those conversations? Do you know when they come into your clinic if they've been vaccinated, or if this is a family who has their concerns? Do you take the time, and what are those conversations like?
Well, again, we're trying to, around any vaccine, we want these to be informed discussions with families dealing with what's actually happening. And so, yeah, that's always part of the conversation with them. Lots of families bringing in these questions, as we hope they will, to us, and wanting to know what we think about them, about the vaccines, what are the risks and benefits from our side. So many of these conversations going on every day in clinic.
All right, so I think we're having some issues with audio on Facebook this morning, so I just want to let you know that we do know that's happening. We're trying to figure that situation out, but keep your questions coming in on YouTube. We'll get to those as well. Okay, so I want to ask about Miss C, that being a concern. What is it, first of all?
Okay, so it's the multi-inflammatory syndrome in children. It's a inflammatory condition that results when a few children, a small number of children and adolescents especially, get infected with COVID, and it results in a variety of ongoing symptoms, most concerningly usually around myocarditis in the families, and again seen in a small number of patients who get infected with COVID.
And so did you mention who is most at risk?
So it's mostly, the big concern is about adolescent males, and specifically came up initially in studies on athletes, and then has been found in other adolescents who get infected with COVID. Again, most of those symptoms, while they can be severe, and there have been some deaths related to it, most of the cases seem to resolve over time, but it's a very real thing and can be quite serious.
And is there a treatment for this?
The treatment is generally just supportive. We try and because the immune system, your inflammation is gone out of whack. Basically, you're trying to calm that down and support the patient through the symptoms of it. So there's not a specific medication for it, more than just this management of the symptoms.
All right, I think we're back on Facebook, and hopefully you're hearing us. Yep, getting the thumbs up. You're hearing us loud and clear. Love that. Okay, and I'm starting to get your questions, so we'll get to those. Before that, though, I want to ask you both, for these parents, though, are still hesitant and have questions, How should our audience members be talking and having those conversations with family members and other parents that their kids go to school with and their neighbors? I have friends that are vaccinated themselves but still have concerns getting their kids vaccinated. They love their kids just the same way I love my kids. They just have concerns different than mine. Mine are, I'm concerned about COVID. They're concerned about other things the unknown. So what are those conversations? What should we say that would help, or where do we send them?
Well, we're glad to talk to them. And I think the biggest thing here is getting actual information in front of parents. They're doing their job. They're trying to do the best they can to protect their children. Our job is to get the information from them that says the best thing you can do to protect your child is to get them vaccinated. For instance, there's been out there worry, and it's about myocarditis associated with vaccines, which has happened in a very small number of cases. It's just important, the important piece to get there is your child is 10 or 15 times as likely to get myocarditis from a COVID infection as they are from any kind of vaccine. So the best thing they can be doing to protect their child against the effects of the pandemic is to get them vaccinated.
Dr. Ault, your words of wisdom.
I don't see pediatric patients, but I certainly get plenty of questions from my patients who have kids in that age range. I think the AAP has wonderful stuff on their website, and the family practice group AAFP is based in Leawood, Kansas, and I've looked at both of their websites in the fairly recent past, and there's wonderful resources online, and those are reliable sources too. There's certainly lots of unreliable sources out there, but I would stick with those two reliable sources, I think would be the best advice I could give.
All right, Isaac has a question. So let's go ahead and just get to some community questions here. We'll take a few this morning. When I heard you mentioned something about the HPV vaccine, I thought back to something I read about how the vaccine conferred very durable immunity. Is that true for Novavax and COVID?
So, the HPV vaccine has been around for 15 or 20 years, so it's a lot easier to answer that question than it is for a vaccine that's not even, been given to the general public yet. But we'll have to see. In a sense, we were lucky with the HPV vaccine because there were some other vaccines developed around the same time that we have had to give boosters for, like the meningococcal quadrivalent vaccines. So, we just don't have data to say that yet. We can keep our fingers crossed that that's the case, but we'll have to find out.
We always have to have a crystal ball
Yep,
question
yep.
for you.
Prediction is very hard,
It
especially about
is.
the future.
Yeah, in
that's,
science, yes, we know.
good.
So, Dr.
Yeah.
Hawkinson, Jean has a question for you. What's your opinion of all the states removing mask mandates when cases are dropping but still higher than the last peak?
I think overall it's still dangerous. It is not consistent with the public health guidance at this point in time. We know those situations where masks prove most useful, and it is those indoor gathering situations. Whether it is a bar or restaurant, whether it's a school, you are still having people who are unmasked. We know how easy it is to spread this virus, especially even 2 or 3 days prior to any symptoms. And I think that goes along with our topic today about pediatric vaccination. We still know a very, very small percentage of eligible pediatrics are vaccinated, and we know there is that large percentage, or really none, under 5 that can be vaccinated as well. And so this just helps perpetuate the spread of the disease. And yes, even for children, we've said this and we know this, their chance of hospitalization and severe disease and death, even multisystem inflammatory disorder, is low, but it's not nothing. And we also know those children interact with maybe people who are at higher risk, such as maybe older caregivers who are taking care of the children after school or when the parents are at work. And so I think it continues to be suboptimal management, suboptimal guidance. It does go away from the current guidance that still recommends masking in those high-risk situations.
Joyce has a question. She has a friend and her husband that are both vaxxed, but was told that they are not going to vaccinate their kids, teenagers and two teenagers and a 6-year-old, because they just don't have a good feeling about it. Are children more susceptible to adverse reactions as they're growing and developing? Can you speak to this fear?
I would say it is a fear, and we understand, again, why parents are looking out for what's best for their child. But that's a fear, and it's not backed up by the data that continues to come in and continues to show, as more and more studies and more time goes by, that these vaccines are safe, both safe and effective. So again, the best way, we do have to be worried about the effects of the actual virus, of the real infection that's going on. And there have been, again, Dr. Ault mentioned the AAP website. So this morning they have stuff on there that shows over 12 million infections in pediatric cases, 35,000 hospitalizations, over 1,000 deaths. In my world, any preventable infection in a child that doesn't get prevented is a tragedy, and that's what we're trying to get to. Yes, there are concerns and fears, and we want to pay attention to those, but the real danger is from the infection.
Yeah, I think that's a great point, Dr. Lauer. I think you have two good points there. Number one, the population data. And we said, the population data, that population of pediatrics as a whole, has lower risk for those complications. But as an individual health, that individual child, if that's your child and they do have that chance of going to the hospital, or they have that chance of getting long COVID and having all of those symptoms last for 3, 6, 9 months, that is a concern. We know the vaccines also, the continued supporting body of evidence does support the fact that the vaccines help reduce those side effects as well. So I think we have to talk about the population level numbers and data, but also that individual child. And if that is your child or your grandchild or someone you love, I think that can continue to pose a large impact on that individual and that family.
Dr. Ault?
Well, I think there are a fair number of vaccines. I can think of 2 or 3 off the top of my head. Pertussis vaccine, HPV vaccine, that are the same formulation. They're given to adolescents and adults. And I can't really think of any side effects that are fading is more common, I think, in adolescents, but that's any vaccine. That's not just these vaccines. So I'm not sure I can think of an example where there's a differential in side effects between adults and adolescents.
Cindy wants to know, can you talk a little bit about which vaccines we believe are good for life? HPV, hepatitis, others?
Well, of course, we didn't know that they were good for life when we started with them. This year's the 40th anniversary of the hepatitis B vaccine and has been wildly successful. The HPV vaccine, in a sense, you don't really know that when you start out. So you can get some clues from the immune system as far as memory B cells and that type of thing, but we don't know that really when we start out, I think. So
You gotta wait, you gotta give it a lot of time.
And I would say we're also looking back through time, and we don't have the same context as the generations before us who were living with those diseases, who developed those complications for all of these vaccines, all of these childhood preventable diseases. With the vaccines, we know the vaccines have aided in stopping those, decreasing those numbers, decreasing the overall population, but also individual suffering from those diseases. So unfortunately, we are just looking back because we are in a time now where we are really standing on the shoulders of those who developed those vaccines and promoted them and got those into the arms so that we as a whole population don't have to suffer those effects. And I think it's a good idea that we have those mandated school vaccines for those vaccine preventable diseases. We don't want to go back to those times where our children or our loved ones are having to deal with those complications of those things like measles and mumps, things of that nature. So overall, they have been proven to be safe. And we just have a difficult time looking back on what things were like. If we were living in the time of smallpox prior to the vaccination, we have to understand that was probably, a 30% mortality rate if you got that. So, we don't have the concept to identify with that here currently because the vaccine has done so well, and we've actually eradicated that virus from the planet. So I think we have to understand what is the context that we are looking at all this information in.
Yeah, that makes sense. Dr. Lauer, early on we had talked about how that we were struggling to get that 12 to 18 group vaccinated. Tell us where we are. Compare that maybe to the 5 to 11 and the 12 to 18, where the struggle is to get people vaccinated and why.
Well, right now the 12 to 18-year-olds are about 60 to 65%, I believe is most recent I saw. The 5 to 11-year-olds are still in the 25 to 30% fully vaccinated realm. So those numbers continue to lag, and I think it gets back again to just these concerns from parents about, is this the best thing to be doing? And again, bringing them around to the idea that yes, it is the best thing to be doing, that the real danger is the ongoing infections from the virus, or of getting COVID. And remember then the pediatric population it's a fourth of the population. There's 80 million people under the age of 18 in our country. And the other aspect of this is there's really no way to get the pandemic under control to get us back to something approaching normal unless we get to that population-based resistance to the virus. And really the safest and best way to do that is through vaccination.
And getting that group on board. Or do you have to wait for them to age out of that group and now they're 18 and they can make their own decision?
Well,
will that make a difference?
We ask folks how much they like wearing masks and how much they like all these restrictions on our lives and all the things that are in place, in varying degrees that have greatly inconvenienced and changed the way our society works. And the only way out of that is to get up to that group or population-based immunity. Waiting for everybody to get infected is going to be a long and very painful process versus getting everybody vaccinated.
Very good point. Isaac may have missed this earlier. Just remind us when we think those under the age of 5 will be able to get the vaccine.
The emergency use authorization allows the manufacturers to make the vaccine before we actually approve the vaccine. So that's a little unique. So in theory, it could just be a few days after the FDA and the CDC have approved it. So it certainly could be by the end of this calendar month, end of February. So,
all right. Mike wants to know, what's the status of Covaxin in the U.S.? It's a vaccine out of India. Are you familiar with that?
Oh, is Dr. Hotez's vaccine, I think, from
what is
Houston. Dr.
Okay.
Peter Hotez has a vaccine that is also protein-based that he has developed, and similar to Jonas Salk, he's not going to get any royalties from it, and it's going to be made by an Indian company. So I don't know. I mean, I know this from following Dr. Hotez on social media. I don't know that they have plans to go to the U.S.
What is Covaxin?
With that. It's another protein surface-based vaccine, and he has been, he's the dean of the School of Tropical Medicine at Baylor. He has been interested in developing vaccines for neglected diseases. I mean, that's been his whole career. So he has a lot of experience in research and laboratory and trying to get things in the easiest form to get to the most people. I kind of already said that, there are 3 billion people who haven't gotten any vaccine, and hopefully the people at Baylor are gonna help fix that for us. He got nominated for a Nobel Prize, he and one of his colleagues, just a few days ago, for developing that vaccine. So I think that's the one we're talking about. If I'm not, we'll have to go back and retape all this part. But I think
you explained something very well.
Well, he's very active on social media, so follow him on Twitter, and you'll hear the whole story. And he's I've heard him speak a couple times too. He's a very compelling speaker too. So.
Well, now we'll know if we see him on social media. Yeah. Okay, and Dr. Hawkinson, I'm going to start with you on this one, but either docs just jump in as well. Can you explain why the virus seems to come in waves and surges? It doesn't seem like people are changing their behavior enough to justify the steep drop in cases. What else might be causing those waves and those ups and downs?
Yeah, I mean, I think a lot of what we talk about when we do talk about surges is definitely behavior. You're correct. I don't think anybody's really stopped going out or doing those practices really since the beginning of the Delta surge that we had seen. I think then we have to go to the virology and the virus, essentially, and our individual and population immunity. We know that Delta was surging, but this also started, we also have to look back in time where we are understanding not as many people were vaccinated or immune back in Alpha or Delta as compared to they are now. When these new variants come through, especially if we're talking about Omicron, we're looking at the virus itself, and we know that there are significant changes on the spike protein. And so that is able to evade the body's initial immune response of those antibodies to cause those infections. That is one of the reasons, as you find and have susceptible hosts, which could be a lot of us, especially for any new variants that come through, that will take over and surge. I think there were a lot of different properties, though, especially because we were dealing with the Delta surge. We know that none of those behaviors had changed, so people were out and about gathering. We know it was the holidays. We know that helped spread Omicron. And although really probably it continues to be cold weather, people are still gathering. The behaviors didn't change, but right now I think what we're seeing is that the virus has really spread through those susceptible populations just by avoiding that immune response, specifically that B cell or antibody response. But we still have those T cell responses to really help provide good protection against hospitalization. So I think it's a number of different factors, but I think what really fueled the Omicron surge was that ability of the virus to really escape a lot of the antibody responses that we had, especially if you were not boosted or up to date with your vaccine series.
Dr. Lauer?
I would say there's only so many people who can be infected in a surge, and we're just seeing Omicron spreads very quickly. So it went through the population, despite some of the masking, trying to separate. It happened to come over the holiday season, and so all those things tended to go against it. And so we just had a rapid infection rate in all the people who are susceptible to it, and now it's running out of people to infect, so those things are coming down. I do think it makes the point, though, that we have to get to, unless we want to just be waiting for the next surge, the next variant, we have to get to this level of population resistance. Otherwise, every new infection that goes on is the chance for a new variant to pop up and start doing the same thing that Omicron does. And most variants aren't as bad, but some of them can be worse. And so the more that the more infections we have, the more actual infections, the more chance we have for the next variant to pop up and have these kinds of things happen again.
Doctor,
I would say in the meantime, we do want to, I think it is important to stress that while none of the population-based things, masking, social distancing, all these things, none of them is perfect by any means, they do have their effect in slowing down transmission of the infection.
Dr. Ault, Sandra has a question. If the vaccine doesn't cross the placenta, how does the vaccine protect the baby when a mom is pregnant with the baby?
So the vaccine components do not cross the placenta. Their RNA and lipid gets digested long before it gets to the baby, but antibodies do cross the placenta. And so the first few months of life, much of the newborn's complement of antibodies are antibodies from the mom that have been pumped through. We do that for flu, we do that for pertussis, and now we're doing it for COVID vaccines. So yeah, that's I always say I want to bring a medical student on the show with me. There's a mechanism by which the placenta pumps antibodies into the fetus.
You can absolutely do that.
Yeah, I'll pick one at random.
Okay, pick one.
So yeah, and drag
that.
them down here from labor and delivery.
Are you their boss?
Well, I don't think they could say no.
That's how do you say no to Dr. Ault?
Yeah.
I mean, you're coming on the show. There's no way around it. Okay, Dr. Lauer, what about myocarditis in teenage girls? Is it only in boys? Have you ever seen a case in a girl? And why?
I have not personally, but there's just differences in infection. So far, most of the data seems to suggest that it's mainly males. Now, that may be a lot of where we're looking, a lot of paying attention to symptoms and seeing how everybody responds. But there are, it's not uncommon. There's lots of things that have differences based on the sex of the patient. So that in and of itself would not be particularly surprising. I think we may find out. It'll be interesting to see as we go along and take a bigger look at this and a closer look at it. Does that really hold up? But right now it does seem to be more male adolescents.
Right. Yeah, we just discussed that data last Friday as part of the Moderna approval. I think it was 86% were male. So you should fact check me on that, but I think that's the number that I remember. But also, myocarditis skews toward adolescent males anyway. Right. Independent of the vaccine, so there's probably some underlying biology there.
I think parents just want to know if they're a parent of a girl, do they need to be looking for any signs, even though it's maybe rare for a girl, but should they be aware of it?
Well, myocarditis is certainly going to be more severe if it's from COVID, and because it's so much less common in females, you're more likely to get hit by lightning, I think, is probably the odds we're looking at.
Okay,
So,
that you put it in terms we can understand.
Yeah,
Dr. Lauer,
yeah,
did you have anything
so-
else to add?
No.
Okay, so what about, Melissa wants to know, what about the vaccine with a mom who's breastfeeding and has received all 3 vaccines? What about protection for the baby then?
Right, so there's a little bit different mechanism. There's actually a really good article in the official journal of the American College of Obstetricians and Gynecologists just a week or 2 ago. So there are 2 different classes of antibodies in breast milk that protect the infant. There's IgG and IgA, again, good medical student question. So, but yeah, women pass those antibodies on to newborns that are breastfed, and there are lots of respiratory diseases that you get protection from for newborns from breastfeeding, but that's a good example too.
Let me see.
I would say that, it's not just for COVID, but from any other respiratory and any other infection we know. That's one of the many reasons that we encourage breastfeeding so much, is that protection to the newborn, especially in that usually first 6 months of life while mom is breastfeeding and passing those antibodies. It really is a remarkably effective protection system for newborns.
Are we seeing any long haul symptoms in kids?
Yes, we are. There's some small percentage, maybe 2 or 3%. It's the most recent numbers I've seen that indicate those symptoms lasting, 4, 6, 8, getting out into many months. So getting into 3, 6, 9 months of symptoms. Again, I think the more we look, the more we may find, but it certainly can happen in adolescence, and we're seeing some of those cases.
Karen has a 5-year-old grandson with hypoplastic heart disease, even had open heart surgery. Is it recommended that he be vaccinated?
Any child, this would be somebody who, after carefully looking at, what medications they're on, their whole story, any child at risk like that whose risk from any viral infection is higher than average, that's the kind of kid we'd really want to target and say that child needs to be vaccinated to prevent them from serious complications of COVID.
Dr. Ault, Ann wants to know, is there any data about a rise in miscarriages in the first trimester due to COVID? That's happened to a friend of mine recently. How do we make sure not to cross that information from someone having a miscarriage, which happens during a time of COVID?
Right, so miscarriage is a relatively common thing, and there have been several studies on this, and they usually come in at 10 to 25%, kind of depending on what population you study and when you study it. I think the best data that we have is an American study. There's some other studies in the UK, but there's a study of 100,000 pregnancies, and some of the women were vaccinated and some of them weren't, and they had exactly the same miscarriage rate. So there's not a plausible biological reason for it to happen. No vaccine is associated with miscarriage, and there's data plus there's clinical data that says it's not a risk. So miscarriage is a very emotionally difficult thing to deal with, and being an obstetrician for 25 years, I've thought about it a lot over the years. Before there was ever COVID and COVID vaccines, was it the beer I drank, at my friend's birthday party? And the answer is almost always no. So, we should reassure people, not just about COVID vaccines, but lots of other things about miscarriages.
What about the risk when you have COVID, when you're pregnant, which is why we encourage women to get vaccinated? Tell us about the risk if you get it.
There's a little bit of data that says miscarriage rates are increased with COVID, but the really scarier data is stillbirths, preterm deliveries, and then that carries over into what we call perinatal mortality. If you're born early, then if you're a newborn that's born early, then you have all the kind of prematurity type of issues. So COVID is also associated with prematurity. The mechanism looks like it's a placental infection. The receptor for the SARS-CoV-2 virus is in the placenta, and so there's some very good data, especially from Northwestern, that's the mechanism. And so it's a little different than some of the other viruses we've seen, and it's scary. We've seen stillbirths, maternal deaths, preterm deliveries. So it's all the news is bad, unfortunately, for pregnancy.
So let's
COVID.
use this opportunity to say, if you are pregnant or
Right.
planning to become pregnant, it is safe and it is okay
Yep.
to get your vaccine, correct?
Absolutely.
All right, Dr. Lauer, anything to add there?
Just the one about prematurity and trying to avoid premature births. We know that one of the, things just don't go as well the more, on average, for those especially very early births. And so trying to prevent those is one of the major things that our OB colleagues work on, and one of the things we want to avoid coming out of this is that any increase in prematurity.
All right, I'm just double checking. Angie wants to know, Dr. Hawkinson, do we know, can the COVID virus cause a seizure in someone who's never had seizures before?
Yeah, I don't see why not. I think we're learning about side effects that may occur, whether that's the actual virus itself or whether it has to do with decreased levels of oxygen in the brain, the cytokine storm that may occur. We don't have a lot of good evidence that says that the virus actually replicates within the brain cells, in the neurocells themselves. But we know that COVID can cause systemic issues because of those things, because of maybe low oxygen because of blood clots. We know that COVID can affect the other cells around the brain, vascular cells, things of that nature, not necessarily the brain cells themselves. But we have seen patients, and I have seen patients who have confusion or what we call encephalitis due to COVID-19 or SARS-CoV-2 infection. So I think that's very plausible, and we are seeing things that can occur secondary to COVID every day. So I think that is plausible. Obviously, if you are going to be evaluated by a medical professional, specifically a neurologist, or if you're in the ICU, a critical care neurologist, you're going to have a full evaluation to make sure that they rule out other common things and not so common things as well. But it certainly is plausible that COVID-19 can cause seizures as well.
All right. 2 more questions today. Peg has a question for Dr. Ault. Can you speak to the changes in menstruation after vaccination?
So there have been a couple of studies about that. So, and it kind of depends on the timing of when you get the vaccine during your cycle. But there are inflammatory receptors in the lining of the uterus, and that's where the blood comes from, the endometrium. And there was a study, again, in one of our big OBGYN journals just a few weeks ago, that there was a delay in the cycle, depending on when you had it in the cycle, and it might be a little bit heavier. But there was no permanent change. It was a temporary change related to that cycle. There's a little hint of that in the HPV vaccine data from 15 or 20 years ago, but we were vaccinating teenagers who have irregular cycles anyway. So it's a little hard to tease out all the other 20 things, again, if we had a medical student here that could tell us, that cause irregular cycles. So, and some of those studies actually have asked about stress levels, and stress levels, of course, correlate pretty well with irregular
So do you think
periods.
this is where the rumor began that it affects fertility?
Actually, I think the rumor for fertility started probably 20 or 30 years ago, because it's been used against tetanus vaccine, flu vaccine, HPV vaccine. It's used against every vaccine,
Yeah. Oh,
okay.
unfortunately. So it's a recycled
I think-
bit of misinformation.
Yeah, it's an old
So-
convention used by anti-vaccination groups that really has no supportive data. So, but we keep rehashing it.
Yeah,
Whatever.
we'll keep reminding. Okay, Taylor is going to get the last question, and it kind of touches on something Dr. Lauer mentioned, and it's kind of a jump ball question, so anybody jump in, please. Can the doctors give a specific number on what population immunity is needed to stop the surges from going forward? Or does this mean that we're just going to have to reset every time there's a new variant, like you mentioned? Is there a number? What's the magic number?
Well, I would say I don't know. We know that it's higher than we have now, and I think that's this becomes something that we learn as you look back and have more data. But
Yeah.
we do know by comparing the infectivity of this virus to others, we know that the best guesses that I've seen are somewhere in the mid 80s, something like that, percent of the population. Although, again, we'll have to see what actually plays out to keep it from spreading and to get that population control over it. Dr.
Yeah,
Hawkinson?
I would agree. I think this is a difficult question. There are a lot of details there. It is really hard to say, because what are we really concerned about? Is it cases? I would say we're probably not as concerned about cases if we know there is some level of immunity there. Most safest by vaccination or infection than vaccination, or vaccination than infection. We know infection does offer some immunity, and as we move through this pandemic and more time, we know that there are probably going to be recurrent infections in those people. But anytime you get infection, you are rolling the dice with the complications, and we know the vaccine helped reduce that. So I think it is really hard to tell. Again, is it cases? Because we had just talked about earlier that, if you don't have those specific antibodies against that particular variant, cases will occur. What we are really concerned about is that surge in hospitalizations and the surge in capacity then that occurs with that, those loved ones going to the hospital, going to the ICU and dying. As we get further into this, more people get vaccinated, hopefully. We also have that large population that is unable to be vaccinated now, that group that is 5 and under. So if we can get those groups vaccinated, if we can continue to develop this population, but also individual immunity, hopefully we will see a reduction in the overall hospitalizations, even if the cases continue to rise. And so I think that's an important thing to identify. When will we see another surge? How will it affect us? It's very difficult to say. Hopefully it won't be a surge as large as that we saw last time, but there are just little nuances there and details there that we have to take into account. And again, anytime we do have a new variant that is able to evade those antibodies, we will probably see large amounts of infection. But if we can have enough immunity, especially from those T cells generated by vaccination or infection then vaccination, we can help keep people out of the hospital seeking medical care, out of the ICU, and of course, keep people from dying.
Before we get to final thoughts this morning, just finally, where can we send parents to get the best, most accurate information about the effectiveness, the safety of childhood vaccines?
Well, I mentioned the AAP website, which I get a lot of good information from. If you really wanted to do a deep dive and have about 6 or 8 hours of time to spend, you could listen to our next meeting of the ACIP. 40,000 people listen to those meetings live. There's live streamed. You can go back and listen to it on YouTube. You could download the slides, whatever if you really want to get into the weeds about that. But the summary information is going to be available from medical organizations.
Yeah. Those would be the sources. We try and direct parents to. A lot of the information is worded and directed towards parents, so it's not necessarily scientific or medical lingo. It's worded in ways that parents can understand and use in their daily lives. So those would be the sites we'd send them to.
Don't just take it from me. There's places that agree with what you're saying and
Yes.
concur.
AAP, I think, has a good social media account too. A lot of times I'll
Yes.
see stuff on Dr. Salaji, who's
Yes.
the current president, or the AAP social media accounts that's useful.
Reaching people through social media one day at a time, right?
There you go.
There you go. All right, let's get to final thoughts. Dr. Lauer, let's start with you.
Well, I think the one we just want to keep getting at is we respect parents' viewpoints on this. We understand that they are doing their due diligence to protect their children as they should. But we want them to have those honest conversations with their child's healthcare providers, get the real information about what's going on, and we believe that will lead them to the conclusion that getting their child vaccinated is the safest, most effective way to protect their child and the rest of society from the complications of this pandemic.
Dr. Ault.
I was kind of thinking about, we were talking about waves of infection. There was a very nice editorial in the Washington Post a week or two ago from Professor Berry. Dr. Berry wrote a book called The Great Influenza, maybe 15 years ago, that talked about the 1918 pandemic. He specifically points out in the editorial that Kansas City had more deaths in 1919 than they did in 1918. And so he talks a little bit about the biology, but more about the social aspects of pandemics that go on for years. It wasn't just 1918. So it's a good read. He's a very good writer, so I would suggest that. So
Very interesting. Great conversation, guys. Thank you both for being with me today here on the desk. Dr. Hopkinson, final thoughts.
Yeah, I think it is a good idea to seek out the accurate information. And we know that there are large bodies that put out that accurate information, those things to start with, just as we heard, American Academy of Pediatrics, American Academy of Family Practice, American Medical Association, the CDC, the FDA. Those places are all vetted, provide accurate information, as opposed to inaccurate or information that is really unsupported by the data. So I think if you can seek those good sources out, we've always said your local or state health departments are good as well. That will help hopefully inform you so that you can make good decisions as well. And just a point of clarification, the Covaxin is a inactivated vaccine. We know that China, and I don't know if Russia has produced one, but we know China's produced inactivated vaccines as well. We know they are manufacturing in India. We also know that Corbavax is the Peter Hotez. That is the protein subunit vaccine, just as you said. But we know that there are a number of different vaccines out there. Also, we know that the mRNA vaccines continue to provide very excellent protection against hospitalization, severe disease, and death. Right now, just as Dr. Ault said, we have the mRNA vaccines and the Johnson & Johnson vaccine approved in the United States. It is hard sometimes to keep up with the other ones, but anytime we can get more vaccines on the market that continue to provide good protection against hospitalization, severe disease, and death, if that helps those vaccines get into arms because people may not want to take one because of the other or for some reason, I think that's great. So the more that we have, as long as they're providing protection, I think that's good. So if we can get Novavax or any other ones online here in the United States, I think that'd be good. The key thing is to get those vaccines into arms.
I think what we've learned is it's okay for Dr. Ault to be wrong one time. You're never wrong about anything.
I freely admit to being wrong frequently.
To be fair,
actually,
there are so many vaccines out there. I think and rightly, we should really focus on those ones that are approved, authorized, and possibly might be approved here in the United States. I think it's okay to focus on those things.
Yeah, for sure. All right. Thank you so much, and everyone, for being with us today. Coming up tomorrow, just a friendly reminder, Valentine's Day is on Monday. Love may be in the air. Your heart is beating fast, but for some, that love might be exactly what lands you in the hospital. More and more women are suffering from something called broken heart syndrome. Dr. Travis Love is a cardiologist here at the health system. He's going to join us to explain exactly what that is and why it is affecting so many people. And also Dr. Stites, he'll be back with us. So everyone have a great Thursday. We'll see you back here tomorrow at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.